Any question?
Please, Conrad and Alessandro, stay both on the podium for the discussion. Maybe I can start the discussion with a question. If you look at the recent ISHLT data, we've nicely heard both sides of the medal, and look at the hazard ratios for 1 and 5 year mortality. You can see that the curve actually starts with a high hazard ratio with a very low centers, then goes down to the lowest part in centers with around 60 to 70 transplant procedures a year, but then increases again with the very high centers. So maybe could both of you, from your perspective, provide an explanation for this?
Yeah, I think that's very important, and it's very hard to actually correct for complex cases. When you just look at the big databases, get diagnosis, but we all know that there are easy IPFs and there are very complex IPFs. There are easy PH and very complex PHs. And like this is something which can be easily overlooked in a publication. It's very hard to correct, stratify for those issues.
Yeah, I tend to agree, and I just think it's up really to the case mix and to different individual patients. But again, probably one concept to add is when you push really too hard, you might get into very, very complex and borderline cases, and that might drop your outcomes again.
Hi there, Jimmy in Dublin. Just a health warning, I'm a pulmonologist, so slightly different perspective on really very good quality presentations. And I guess the message is does volume equate with quality? As a pulmonologist, that's not necessarily the test, I would suggest, because access to transplantation is really important. So if you have super regional centers, and an older IPF patient may not get access to that center easily. And I would suggest that the true measure of a quality transplant program is conversion rates. So our surgeons here do about 35 transplants a year. That's only for 4.5 million people. So if you have a center doing 50 million or 50 transplants for 10 million, it might, when you go for coffee at the conference, that might sound a lot, but it covers a very big population, and access then is extremely difficult. So congratulations on a very good debate, but let me suggest that conversion rates are the key thing of quality.
Sure.
Walter Klepetko, short comment. Congratulations both speakers. However, Alessandro, I have seen a particular problem in your talk, which is spoiling your message. The reason is you are by definition a small center, but you're not behaving like a typical small center, and I congratulate you on that. You're an outstanding team having all these features. So what I think this talk aims about is talking about the normal small volume center, which is missing many of your features. There is one argument which was not brought up by both debaters, and I think there's a very important one, and this is also going to what Jim has said about access to transplantation and use of organs. We just sent a paper away where we reviewed all the outcome of recipients receiving donor organs which were rejected by minimum 3, maximum 10 or 11 other centers before for quality reasons that were ultimately used by our center. The outcome, I can tell you, was identical to all the other patients. This is a very strong message that the use of available organs and the very scarce resource might not be as good as it could be, and there is some waste of organs outside if there are centers with less experience which are not willing to take a higher risk evaluating these organs.
Yeah, thank you, Dr. Klepetko, for the comments. And I tend to agree. Obviously, my talk needed to be provocative, so I totally agree with you. But on the other side, I think the message is pretty much similar, and we need a lot more metrics to draw conclusions. And I think the metric about organ utilization is a very important one, as well as the one that was mentioned before by our pulmonologist colleagues, so access to transplantation. And I think we really need a very complex and statistical, mathematical model to give an answer to the question.
Okay, thank you very much for excellent presentations and a very nice discussion on structural quality.